name is Natasha Bidadi. I am from, it's a little bit of a combination. I was born in Dallas, Texas, but I moved to Rhode Island when I was 8 years old. So I pretty much spent over, I feel like a Rhode Islander now. So it was very natural for me to go to URI. And I graduated in 2016.
Nice. Not too long ago.
Not too long ago at all, no.
No. Why did you choose to attend URI?
So I had originally, it's interesting, I originally put down a deposit to go to school in DC, and I was going to go to Howard. I was very attracted to moving there, and I had gotten a prognosis for my father that, with this cancer that he was diagnosed with, that if, he went through all the therapy that was recommended for him, he had a prognosis of 5 years. So I just decided to stay close to home, and he had lived those 5 years, so it was very fulfilling to be there. And then on top of that, URI is just very well ranked and recognized, and I'm very happy that turn ended up happening because I got to stay with my family, but I also got to go to an excellent school.
Yeah, I totally understand your decision. I always say that with in regards to COVID, I was grateful for it because it let me be home.
Absolutely.
So I understand that. It's good to just be home. But
it is
perfect.
To be close to home or to have the support of your family or your loved ones, your friends. I made the right choice. At first, I thought that I needed to get away, but I found out that being close to people that I love was very helpful and important during pharmacy school.
Yeah, it definitely helps your state of mind and everything like that, for sure. Maybe you'll find your way to DC one day.
Exactly. I don't live far from DC now, so I can just 2 hours away.
Sure. Okay, so what is your current title and your current employer?
Yeah, of course. So I am a home infusion pharmacist, and my current employer, they were purchased by CVS, so it's Coram, that's CORAM, Coram Infusion CVS is the employer. And I work on a team, so it's an infusion pharmacist, but I have a specialty in nutrition or TPN. So I'm considered a clinical pharmacist on a TPN team, which is total parenteral nutrition. It's IV nutrition.
Cool. I've never heard of, this is a totally new world of pharmacy.
Yeah, this is a new team. It was something that was created just last summer. So Coram is one of the leaders, in infusion pharmacy across the U.S. And what they had wanted to do was streamline the level of care that TPN patients were receiving, because they realized that from branch to branch, there wasn't much standardization for their care. They found that a lot of the registered dietitians were very specialized in what they were doing, but the pharmacists, TPN is so specialized. There are a lot of calculations that you have to do. There's a lot that you have to adjust week to week. So you really need to train a pharmacist that's able to handle the needs of the team and of a TPN patient, which can be heavy. They say of all the infusion therapies that anyone can be on, nothing weighs more than a TPN patient, because you're often handling, TPN plus a specialized hydration at times. In addition to that, you're adjusting lab electrolytes weekly, usually for the first at least couple of months that someone's on service. So there's a lot that goes into being able to adjust someone's labs based off of their electrolytes. And then on top of that, they're often, they have central lines, so they often have, unfortunately, line infections that you need to be able to provide antibiotics for them as well. So it's complicated, but it's extremely rewarding, and it's really good to have someone who's trained and specialized in being able to convert hospital formulas to home formulas and just adjust with the adjusting needs of the patient.
Yes, for sure. That is so cool.
Thank you.
Did some of your background with dealing with your family kind of contribute to wanting to do this?
It did, because a lot of my patients are actually post-surgery. They're cancer patients who have had surgery that need to go on bowel rest, all sorts of things. And my mom actually had stomach cancer, and she had a G-tube for a period after her surgery. And a lot of my patients are what we call dual enteral and parenteral nutrition patients. So they have G-tubes, and then they also have, they receive their nutrition and their hydration usually through a central line. So it's a lot of dual patients, and definitely seeing both of my parents with cancer and how how much it can weigh on a family. It's helped empower me in this role and prepare me for the heaviness of the role as well. To
Yes,
serve as
that's so,
a person of strength, a position of strength for my patients and empathy.
yeah. Yes, and that your patients are very lucky, but they have someone there that knows what everyone's going through, for sure.
Thank you. Yesterday was actually one of those moments, like you never, at URI, they did a good job of teaching us in different labs that we had in an IAL. It was like in more intimate settings. They would teach us about difficult conversations that we could have with patients about ethics and all sorts of issues, but nothing can fully prep you for what it's like to discuss a family member going on hospice. Yesterday, I was adjusting. I was doing a PCA, so it was actually my first time not double checking, but actually having a patient on a PCA, because the branch that I support remotely in Ohio doesn't even stop controls. But my patient is so severely ill that a nearby branch in that's about an hour away is, they accepted the offer to provide the PCA, the hydromorphone infusion, and then I provide through the branch that I service. I work on a team. We have 7 branches now and we're growing, so I can jump in from site to site to take care of patients in different locations. And this was really nice because this is a group effort between multiple branches. And I was handling the PCA and I was talking to a patient's niece about hospice, end of care, end of life discussions, that sort of thing. And I was able to speak to her about the experience of having my father on hospice. And that really was a place where we were able to connect. And she just felt like I understood, what she was seeing and what she was going through. And that felt really nice to be able to speak from personal experience and connect with her that way.
For sure. That is definitely like where you feel like you're helping as a pharmacist.
Exactly.
I feel like a lot of people have said that to me over my rotations this time too. So
Sure.
you're inspiring me.
Oh, good. I'm so happy to hear that. But yeah, sometimes you can take these moments in life that, hurt you personally, and you can use them to connect with people. And when you do that, you realize that you're not the only one in the world that's going through this pain. And then you can also use it to connect with people. And when you have that connection, they're more likely to listen to what you have to say pharmacy wise. She just kept saying, I trust you so much. You've been through this. My doctor said this, but what do you feel about this? Because I don't trust what they're saying. Like, do you agree? And she was like, now that, I've spoken to you, she's saying I can accept this recommendation because I trust you and I believe you. And it sounds like you've been through this. So it's just a really nice way to feel good yourself, because you recognize that you're not the only one going through pain, and then or through loss or suffering or difficulty. And then on top of that, you can use it to empower your patients to accept, or learn more about what their providers are telling them, which in turn is going to help their family members and everyone involved.
That's awesome. Awesome.
Good.
I will go back to the questions. What's a typical day at work look like for you?
So I was thinking about this question yesterday, and I feel like there's no truly typical day where I work, because what happens is I have patients that go into the hospital, they come out of the hospital, and then we take on new admissions every day. So every day looks a little bit different, but there are some consistencies that I have day to day. And the first thing that I do is I check my email from home even before I go into work, and I get the ball rolling on any sort of new orders that I need. I work with half of my patients are taken care of by Cleveland clinics. So if I'm waiting on labs for someone or something's going on with one of them, I'll send them a proactive email to tell them that I'm expecting this order today. It has to be mixed and shipped, and the patient needs it by this time. So I need the order by like X time in order to be able to dispense it that day. So normally what I do is I check my email, and I tend to get, this is very new for me in this role, I get one email every minute for about 8 hours. So I've learned it's insane. I've learned how to set up Outlook rules that filter through emails that don't apply to me, because I work for a hub that serves or takes care of 7 branches. So I think it's really important with your email, if you have a job like this, or you end up taking a job as a clinical pharmacist that supports, different, because this isn't new in the pharmacy world to work as part of a hub or a call center, which is essentially what I do. I do all the clinical processing for TPN, hydration, antibiotics. If my patient's on TPN and they have any other IV needs, I take care of all the needs. And they've put us in one location, a whole staff devoted to that. And we take care of branches across the country. And that's one of 3 hubs, and they're going to expand and create more hubs with time. So it's important if you have a job like that where you're taking care of patients, where you're getting emails frequently and you're taking care of patients in different locations, that you know how to set up these Outlook rules that filter through things that you don't need, so you don't end up wasting precious time to read about patients that you're not taking care of in that moment. But yes, so a day I always check my email. I reach out to prescribers proactively, and then I have calendars that are set up with all my patients' names and what we have different colors. If I'm waiting for labs, if I have labs and I've sent them to the doctor and I'm waiting for a call back, if I've taken the order out of review and I've like signaled to a CSS, or it's like a pharmacy technician, to put something in review, I have a color on the calendar that indicates that I've taken it out of review and sent it for a double check. And I just review anything that's not blue. Blue is good because it means the order's processed, it's printed. If that's not blue, I just make a list of what I need to follow up on. And then I have multiple calendars because I take care of 2 branches now. So typical day is starting with checking the email, following up on any new orders that I need, and then just taking care of double checks for my peers. And I jump in a lot of different meetings throughout the day, and just taking care of the patients that are either like routinely I'm managing, or the ones that are coming out of the hospital or new admissions, and just helping wherever I can with that. I'm often calling prescribers, yes, for new orders based off of high or low potassium, high or low magnesium. Let's say someone has nutrition goals and they want to gain or lose weight. I'm often, suggesting an increase or a decrease in dextrose or amino acids or fats. And then I do a lot of learning on the job. One thing that I really wanted to talk about in this interview is you don't need to learn everything in pharmacy school. I learn every day, I learn about dispensing a different antibiotic, stability for it, how to mix it, what concentration it needs to be at. I learn about different fats. There's all different kinds, intralipids, neutralipids, lipids, omega-ven. And I didn't know about these things. I didn't learn about them in pharmacy school. I learned about math of how to calculate and balance acid-base type things, which comes into play with this job too. But I didn't learn about all the different products that I was going to dispense. But I learned on the job, and I always ask for help from people who have been doing it for 10, 20 years. So there's a lot of resources, there's a lot of policies that I can learn from. And I think it's really important to note that you don't need to know everything. You just need to learn how to find out what you need to know to make sure that you can take care of your patient and make sure that they're safe and getting the care that they need.
Awesome. Yeah, I was going to say, I'm like, we only really have that one nutrition class in regards to TPN. So
exactly, but you learn on the job. And I learned as a dispensing pharmacist at Omnicare, I used to learn on the job too. There's just simply no way you can learn everything in pharmacy school. I think it's important to have the mindset that you can learn every day what you need to do. I used to think to myself, well, they never taught us this in pharmacy school. And then I realized they taught me the skills that I needed to obtain the information that I need. And you just end up growing with every position you have, every day that you work, different dynamics that you have with coworkers, patients. You just learn and you grow every day.
They say pharmacists are lifelong learners, so
they
makes
are.
sense.
It's important to have that mindset, because you can get bogged down and think, I never learned about this in school, but it's on us to keep learning.
For sure. So who do you interact with on a day-to-day basis? Do you work with other healthcare professionals, like dietitians, I'm sure you work with in regards to physicians and things like that?
Definitely. I work most intimately with dietitians because they come from like a very specific skill set where they're able to recommend like essential fatty acids that my patients need to meet. And they were the first ones who taught me about balancing. I never knew that a dietitian could teach me about chloride and acetate ratios, and sodium chloride versus sodium acetate, and potassium, phosphorus. They've taught me so much. So it's registered dietitians, prescribers, doctors, nurse practitioners, surgeons. I work with a lot of surgeons because they're, they usually go in, do something where they resect someone's bowels and the patient can't eat for about a month, even longer sometimes lifelong. So I work with a lot of surgeons to keep patients stable, post-surgery. I work with a really nice, robust team of clinical support specialists. They're like our pharmacy technicians. They are the backbone of our team. It's amazing what they can do. And they're always so good about reaching out to patients about what supplies they need, because with home infusion, you're not just infusing medication. You need supplies to, pumps and supplies that allow you to infuse. So I had no idea before I started this job about the complexities with pumps and pump programming and flush protocols with saline or heparin. And then if the patient had a port versus, different central lines, peripherally inserted central catheter. So the technicians are so good with just sending the patients the right supplies that they need for their orders and the right tubing for, whatever they're infusing. So they're incredible. And then I work with a lot of other pharmacists. I work with pharmacists at dispensing branches that fulfill the orders that I process and print remotely. And then I work with a team of clinical pharmacists myself, and we all support each other with our double checks for all of our various patients. And we learn a lot from each other as well.
Nice. You sound like you have a good team there.
Oh yeah, it's super strong.
Do you just do TPN and antibiotics, or is there other things like my mom had a home infusion of IVIG? Is that something your place would do too?
Yes, 100%. So I don't have any patients on IVIG, but one of my peers, Becky, does. So when she's off, I've had to process, a subcutaneous IVIG, and then you have to learn about this Freedom 60 pump that has 6 different points of contact in someone's skin. So it's, the nurses, I work with tons of nurses. I forgot to mention that. And they're the ones who teach me a lot about, the home administration of these medications. So we do, I have another patient on another branch on chemotherapy, 5FU. So we do some chemotherapy, some specialty IVIG. I do, depending on the branch, we have anti-anxiety medications, seizure medications, just depends on the needs of the patient. But if they're getting anything IV, our team is providing it. Oh, and Gattex is a big one. It's for short bowel. It's indicated for short bowel. It's subcutaneous. It's an injection. So we handle that too. A lot of patients are on it.
Very cool. I feel like there's a lot of different drugs that you have to look into and learn about because they're not common.
Not common. IV iron. I mean, tons of things. If someone's getting it, and we will provide it.
Very cool. So what makes infusion pharmacy unique to other fields of pharmacy?
So I was thinking about this last night, trying to convey how unique it is. But I think one of the most amazing things about it is you can keep someone who's just left the hospital, you can stabilize that person at home. So you're able to offer them this ability to be around their family, to be in a more safe space. I had a patient who was in the ICU for 200 days last year, who was successfully able to transition to home. And we've been able to provide her and all of her needs at home. So I think what's very special about it is these are people that if I'm making one mistake where I don't fulfill an order, they have to go right back to the hospital for the majority of them. So I think what makes it very special and what makes it so incredible is you serve as this person that can offer someone the ability to be in their own home, to be in their own bed, or even in a hospital bed at home. They would be where they're able to be around people who they love. These patients, they just cannot stand, and I don't blame them being at the hospital for days on end. They always complain about the hospital bed, the staff, the noises. So it's really beautiful to be able to help them stabilize them and bring them into a place where they can be at home.
That's awesome. I experienced this firsthand, and I agree that to have your patient at home feels awesome.
So good. It just feels good for the family too.
Yeah. Especially during COVID, where family members weren't allowed to go in.
Yes.
So it was patients were by themselves. That's so hard.
It's so hard. It's very isolating. It can be like demoralizing. It can impact outcomes, I feel. So what I do with my patients is I do everything I can to get them home, but they know that if I say you have to go to the hospital, they listen to me because I'm not the kind of
Yeah.
person that's going to tell them to just go if nothing's wrong. I tell them to go when certain labs are critical. I tell them to go when they have these fevers and chills, or when they get these odd sensations when they're flushing their line, because I know the signs of a line infection and how deadly it can be. So I do everything I can to keep them at home, and I think it's beautiful, and I'm just so grateful for it during COVID. But I definitely sound the alarms when they have to go.
Yeah, that's fair. Do you find that a lot of your patients are people that just can't leave the home too, like paralyzed or like leave their home?
Yeah, I do have some patients who cannot leave their home as well, or like they're not mobile. I have patients who are not mobile as well. Yes, absolutely. I have that one patient I was telling you about. She had developed this hypersensitivity reaction to everything: foods, drugs, medications, you name it. And she even responds to hot and cold, like can precipitate attack that like lands in the ICU. And this only happened to her after the Gardasil vaccine. That's like was the beginning.
Wow.
Yeah, so it was really, really strange the way and unfortunate the way things developed for her. But yes, she is essentially bedbound. So it was very motivated to do anything that I could to keep her out of the hospital.
Makes sense. That's cool. Your program's very cool.
Yeah, it is. It's
awesome. So what skills and traits have helped you to exceed in the infusion pharmacy setting?
Yeah, I would say the clinical knowledge background that I gained was crucial, very essential. I remember some of the things that we learned in school that have stuck with me until today. And I think that one of the most important things that I learned at URI was just how to find the information that I need, or how to I just felt like they prepared us so well in terms of being able to do research. I think about Dr. Ward and all the skills that she was able to instill in us in terms of research. That was something that was key, because you're never going to know. Things have changed even since I've graduated. I've looked up guidelines that I read in 2016, even 2017, and they've been revised. So I think what's key is I know where to find the information I need, and how to interpret it, and then how to assimilate it into my daily life at work. And another thing that I'll mention is I had amazing preceptors during mostly URI faculty during my rotations, and they just taught me. They developed this ability for me to form a connection between a disease state and how you treat it, and just things that you just can't learn from reading a book. So they filled in a lot of dots for me, and a lot of pieces, and a lot of other URI students as well that were on rotation with me, or people that were older and fresh out of school, residents that had gone to URI who were at the places that I was rounding. I still think about them, and I think about what they taught me, and it's all stuck with me, and it prepared me beautifully for what I'm dealing with now.
Awesome. Yeah, I agree with you. The rotations really connected so many dots.
That's what it was. It connected a lot of dots.
And I feel like also the organization skills you have to have with all those email and keeping everything together with all the hubs.
Exactly.
You're good at that too.
Skills. Like when you were asking me what my day is like, the last few months I just learned how I utilized like the skills that I had learned to organize, because you just have to be on top of everything. Otherwise, something's going to fall off your list, and a patient is going to suffer because you weren't organized enough.
Yes,
you remember something, which can happen, and that's why I always like to have an extra supply, the 1-day bridge for all of my patients. I schedule all of them to have a day supply of everything that they need, or more than that, in the event that something breaks, in the event that something happens where they end up calling you because we've forgotten to move them ahead on the calendar, or forgotten to touch base.
What is the most difficult part of practicing infusion pharmacy?
I would say the on-call. It's I had worked at Omnicare and we were on call once or twice a week maximum, but this job is 7 days straight. So it's and it's only like when I started it was every 3 weeks, and now it's every 4, and eventually it's going to be every 6. But it's very tough to be on call and be at your best when you're in your apartment or want to be spending the weekend with like a loved one, and then these crises. Multiple people have crisis, like home infusion like doesn't sleep. So you have to be able to respond to issues. You have to be able to direct patients to wherever they need to go, whether it's follow up with their provider or to an emergency room. It's the hardest part because you don't tend to have the support of your peers who have expertise around you. So you kind of just have to make the best decision in the moment. You could always call them if it were an emergency, but you just try to learn how to handle what's in front of you. And when you're very tired and drained, it's very hard to support your patients in there.
Yes, I always thought that was the hardest part, was making that call of having to go to the ER. That was the hardest part.
It's definitely hard. It's really disappointing for some people. They're worried about ER copays. They're worried that they're not going to need to go. They're worried that their loved ones aren't going to be able to go with them. And you have to know in your heart that you have to be strong and you have to be confident that this is the right choice. And I feel as though they appreciate that transparency and that, you explain, you spell everything out for them, you give them the risks and then, the benefits, and then they make the final choice ultimately. And you document everything. Conversation and follow up and just make sure that they're okay.
Which is the main goal, to take care of them. So awesome. What's the most rewarding part of your job?
Oh, I think we touched on some of the things already, but I would say that when you're able to help people meet their own goals and connect with them in a way that improves their care, I think that that's incredibly rewarding and incredibly fulfilling. And also being able to help, save lives. Like when, someone's potassium is too low or too high, and I know to direct them to an infusion center, even instead of the ER, and I'm able to have it repleted or having them hold their parenteral nutrition just to get things in like a more level place where I want it to be. I find it very rewarding because you can improve someone's life. You can make it so that they don't have an arrhythmia or some sort of damage to their heart. You can make it so that they're able to I caught this reaction that one of my patients had to daptomycin recently, and her doctor told her that had I not in the ER, had I not directed her, she was begging me to stay home. She was like, I'll just infuse my lactated ringers, it'll be fine. And I was like, no, you must stop this medication. We need to get you on another antibiotic. She just had all the signs of this this terribly adverse reaction where her muscles were all they were just her whole body was in pain, and she was crippled in a fetal position, and I knew she was just responding exactly. I knew what her labs looked like without even looking at them, because I knew her creatinine had gone up, I knew her CPK had gone up, and I just knew that she had to stop that med, clear her infection, and make sure that everything was taken care of. And they said that had I not directed her and had she not gone, she would have her kidneys would have failed. There would have been no coming back from it. So I'm just grateful that we had a rapport where she actually texted my work phone. She told me about the color of her urine and how she felt, and I was like, this is bad. You need to go immediately. And she was and then she was able to go to her daughter's wedding a couple weeks after, and she just it was amazing because she sent me pictures from the wedding, and she told me that I had just been like an angel for her and really helped her finally make it to that wedding, and also just stabilize like her illness and make sure that her infection cleared. It really meant a lot for me to be able to do that for her.
That is so cool. You really have a good connection with your patients.
I do.
Which is awesome.
I do.
And like, you're lucky.
Yeah, I'm very lucky. I'm lucky that they text me. I'm lucky that they call me. I'm lucky that they trust me. So I feel very grateful for that.
Awesome. And I know we touched a little bit upon it, but how else has your ride prepared you for your job?
Yeah, I would say that we touched a little bit on it in terms of the skills that I have like developed, being able to learn where to find the answers that I need. But another thing that I was thinking of was just it was all the people. Like what I loved about URI was you would constantly have different resources and people you would connect with, whether it be other students, faculty, your preceptors. So I just felt like the diversity of my exposure to all these different diverse. What I loved was I learned from so many different pharmacists and different providers, and I felt like it just prepared me for what I needed, what I'm doing now, because I found that I just learned from everyone around me.
Which is what you do on the job anyway.
Which is what I do on the job anyway. And one of the scariest moments that I had, I remember, was at the VA, and I had to give a presentation to a room full of like 20 pharmacists. And it made me realize that shortly, like one rotation later, I gave a room, a presentation to a room full of 50 doctors. And I'd rather give each day of the week a presentation a room full of doctors instead of pharmacists, because you come from a position of expertise, whereas your peers know, they know what's
know what you're supposed to know. Yeah.
But what was so good about that confrontational like experience or setting was that it really taught me that you can learn a lot from your peers. Like there's nothing to actually be afraid of.
Awesome. That's so cool.
Mm-hmm.
And then I think our last question, what is your best piece of advice for a pharmacy student deciding to come to URI?
Oh, yes. So I had like a couple different responses for this. I was thinking about this a lot. And one of the things that I was thinking about, kind of emphasizing is just taking time this is for, can we talk about what they would do like after they graduate or just while they're there?
Both. This is for people to try to learn about the different fields of pharmacy prior to being like P4 or P3. So, yeah.
Yeah, I would say just choose rotations that I don't know how to say this, but that aren't easy. The ones that are going to challenge you, the ones that are going to make you uncomfortable, the ones that are going to make you grow. Because what I learned is it's so much better to be the student who doesn't know something in the hospital than the pharmacist who, is being paid to be there who doesn't know something. So when you're in these settings where you're the student, it's okay if you don't know everything. And it's okay when you're the pharmacist and you don't know everything as well. But I would say to challenge yourself, even though it's uncomfortable, it's actually more comfortable to do it as a student than as an adult, who has to balance so many other obligations that get added every year of your life. So when you're younger, you're able to, I find, I don't know, every year I just learn more and more, but there's this ability that you have when you're in school of this like singular focus that you can give something. So I think it's beautiful to be able to challenge yourself in that environment where there are people around you who are going to be able to support you, going to be able to teach you, and they're going to give you leeway and latitude because you are a student. So I would just encourage people to not take the easy route or the easy route and just go for those things that people say this is a hard rotation, because that's what's actually going to make you grow. It's what's going to make you stronger for your patients that you're going to serve in the future. And it's actually going to make you like more efficient and faster at your job, because if you can survive in that other setting, you're going to be able to survive in the one that you have to wake up and go to every day and do your best at. One thing that I forgot to mention to the students and to you is just I still communicate with Dr. Estes, semi-regularly, and I reach out and I network. And when I was looking for another opportunity after my last position, I was able to reach out to her, and she was actually the one who really helped me get my first job out of pharmacy school, which set me up for everything. After that, I stayed at that job for 4 years. Then I got this job, and I've been able to transition into a role as a clinical pharmacist without a residency. So I would say to maintain your relationships with those people, and then just reach out when you have questions. Like you can reach out to me, because we just need to support each other and help guide each other. There are some things that I wish I knew right out of school, and the only person you can ask people anything, and if they can't help you, they can't help you, but at least you've asked.
Awesome. Also good advice. They say pharmacy is a small world, so.
It's a small world, and it's your reputation will be very well known by your peers. So it's important for you to take care of your patients, but also to treat your peers with respect. And one last thing that I really wanted to touch on is it's really easy to criticize a peer when they make a mistake. And it's really easy to say something like, I don't understand how someone could have made this error. But until you're in that person's shoes in that moment and doing 5 things at once, you don't realize how easy it can be to make an error. So I would say just to protect your peers around you, and always be gracious to them. We can all make mistakes, and we would appreciate that same latitude. So that kindness and a non-judgmental attitude will get you much further than trying to criticize someone for making a mistake. It can happen to anyone. The key is to try to avoid making that mistake again.